Today we are Today we are joining the entire world to celebrate International Albinism Awareness Day. This day was given by United Nations. We are moving under the theme, inclusion is strength. As people, we think that when we work together, regardless of our appearance, our way of life, we need to be working together for any progress. This day is when we reflect on what have been achieved, but also the challenges that we face. And as persons with albinism, yes, we appreciate all that government is trying to see that our lives are improved. However, we still have some challenges. And one of the challenges that we have as persons with albinism are high cases of skin cancer. For example, if we are not protected so well, many of us die skin cancer. And that's why we urge the government to purchase cryogun. These are the machines which are used to freeze precancerous cells. As an organization, we had one machine which we've been using around the world, around the country. But it is now old, and today we are launching a new one. And we've seen its impact. For example, last year we had 20 cases of precancerous cells, but using our program we were able to treat 16 of them. However, 4 didn't make it. So we think that if we have this kind of machines, really will save many persons with albinism to get skin cancer. That's why we continue to urge the government to distribute, to purchase these machines so that they can be, found in every health centers, or even a research center for all referral hospitals. That will be the way we can reduce the cases of skin cancer. Secondly, we continue to urge the government not to see sunscreen lotions as cosmetic. It's a medicine to us. Without it, I can't operate. I can't do my work just like anyone else. So we urge the government to see sunscreen lotions as medicine to us or assistive device. Secondly, we continue to appeal the government to include the sunscreen lotion among the medicine that they purchase, such as paracetamol, ARVs, and other drugs. Let it be among the essential drugs that we need in our hospitals. When we do have it, it will be easier for anyone, even in the local community, to access it, and in doing so will be really reducing the risks of skin cancer.
How much are these machines?
The machines, for example, which we are launching today, it can be bought at 6 million Ugandan shillings. That's why we say that as we are in this budgeting process, it should be thought of so that maybe as they're purchasing many things, let them also include these machines. We should be reminded that it's the mandate of the government to see that the livelihood and the lives of its citizens is at a good state. So we urge the government, because it's your number one.
Okay.
So we've seen that with the usage of our cryogun, it has really reduced the cases of skin cancer. For example, in places where we've been using it more so in Busoga sub-region, it has reduced to 80% of those who have risks of skin cancer, because now their skins are so clean and they have any chances of getting skin cancer. So we think that if maybe we continue using these machines, or if they are distributed in different hospitals, will really help to reduce the cases of skin cancer. Because yes, they don't treat skin cancer, but they limit, or they kill precancerous cells, those cells that would turn into skin cancer. That's why we say that we need these machines. If we have them, that will be one of the ways to mitigate skin cancer.
I also want to call upon government to put in more efforts in preventing cancer development amongst persons living with albinism. One, by including procurement of sunscreen lotions to be part of the minimum health care package as one of the essential elements in that package. Just like it provides ARVs, Panadol, Coatem, mention them, such that we can prevent development of cancer among persons with albinism.